Hello everyone, my name is Dr. Adam Bonington and I am a gender-affirming surgeon in San Francisco, California. A lot of patients ask us about how much pain to expect after vaginoplasty surgery. And you might be surprised that it actually varies a lot from patient to patient. For our patients who have already had FFS, some say that that procedure was more painful and a harder recovery, and others say that vaginoplasty is worse. But either way, vaginoplasty is of course a major surgery involving some very sensitive body parts, so it is understandably a really big recovery. The most significant pain and discomfort is usually the first week after surgery. Not only have you just had a major operation, but at the end of the surgery, we physically sew a bandage to the outside to maintain pressure on the new vagina. And there's a lot of pressure that first week, while the packing's still in place. There can also be sharp shooting pains in the groin area, dull throbbing pains, or intense fiery pains, especially where that bandage is sewn in place. But thankfully, most patients find that the pain medications we give them help make the pain tolerable. It's usually hard to get rid of the pain completely, especially that intense pressure sensation. But the goal is that the pain level is down to like a 3 to 4 out of 10, where the pain is there and annoying, but you're not miserable. To help manage the pain, we actually use 4 different pain medications after surgery. We prescribe a medication called gabapentin, which is a medication that helps with the nerve pain. We also have our patients take acetaminophen, also known as Tylenol, around the clock, and for most patients we will also include ibuprofen, also known as Motrin or Advil. And lastly, we also prescribe a narcotic pain medication, usually oxycodone, which most patients take every few hours that first week as needed to help with the most intense pain. Ice is also really important after surgery for both pain and swelling. One of the things we're really conscious about is the opioid crisis we are experiencing in the United States. Opioid overdoses have nearly tripled since 1999, and a lot of that is a result of increased prescribing of narcotic pain medications. We absolutely do not want our patients to be in terrible pain. We also need to make sure that we're being responsible and not prescribing more pain pills than are necessary. Most patients are able to stop taking their narcotic pain medication after that first week when the outside bandage is removed, and they usually have a few pills left over for times when the pain maybe does get a bit more intense. In rare cases, we can write for a second prescription of narcotics for patients experiencing greater than average pain, but sometimes insurance won't cover a second prescription. And so we really do want to try to manage the pain as best we can with the other medications that I've mentioned. A few times we have had to refer patients to pain management specialists to help deal with their pain after surgery, but this is more common for patients who kind of deal with chronic pain and opioid dependence prior to surgery. I know the idea of pain after surgery can be a really scary thing to think about, and I wish I could say the recovery after vaginoplasty is super easy and pain-free, but that's just not the case. But for the majority of our patients, the amount of pain and discomfort gets better week by week. While it's common to have soreness or even random sharp shooting pains for several weeks or months after surgery, it does get better over time. I hope that was a helpful overview of what to expect in terms of pain after surgery. Let me know in the comments if you have other questions, and feel free to reach out to our clinic if you'd like to make an appointment.